Hi my loves, welcome back to my channel. Today I have a nursing school update for you. I finished my peds clinical, so if you want to know how it went, subscribe, hit that notification bell, and keep on watching. Okay, so I am almost done with my third, oh my god, my fourth semester. My fourth semester starts in like 4 weeks, 3 weeks. I'm not excited about it, but we'll talk about that in another video. I am almost done with my third semester. This semester with OB and peds, and I loved it. I felt like, you know, I found my nursing niche. I don't know. I really like women's health. I really enjoy like the birthing process. And that's probably because I'm a mom myself. I have children, so I kind of connect with my patients on that level. But the last 3 clinicals that I had were pediatric clinicals, and I thought it was going to be similar to med-surg, and in a way it was, because a lot of these disorders, you know, these little babies or kids or teenagers are similar to the ones that adults would have in med-surg. But it's kind of like med-surg bumped up a couple notches, because not only are you dealing with a child and their developmental needs and the stages in which they are in, you're also dealing with the parents as well, and it's the whole family as a whole. So I felt like after my clinical day, I felt absolutely exhausted, like mentally and emotionally exhausted. And again, I'm a mom, so I kind of put myself in that position. So it was difficult on the emotional side of nursing, because like I'm grateful that my kids are doing well and they're healthy, but I'm so sad for all these children that are suffering with all these disorders and debilitating diseases that I couldn't, you know, I wish I could take it away for them, and I can't. And all you can do is be there. Support, emotional support is super huge in pediatrics. And the stories that you hear can be very sad, and you're like, oh my god, what? How could they? You know, or like, what happened? Or the whole situation between why they're there pulls on the heartstrings. You have those, you know, those parents that you can just see in their eyes that they are just sad and they just want their babies to be healthy and to come home, and to see that pain in their eyes and hear it in their voices and in their concerns. Just, oh my god, I just want to like hug them and be there for them. So it was super difficult as far as like emotionally, as far as, you know, the duties and things like that. There are more, you do more, you are, you know, at the bedside a lot more. You're not just passing meds, you are really holding the parent's hands, and if there is no parent, then you really are that #1 caregiver for that patient. I did have a day in ICU, which I preferred the ICU floor over the regular peds floor, where you had observation and post-op patients. I really like that one-on-one. I think my calling is like one-on-one care. I really enjoy that. To be able to, you know, I've done med-surg already, and to have like 6 patients, I just don't, it's hard to like connect with your patient. But in the ICU they had 3 patients, and it was a better environment where you could connect with those patients and just feel like you were making a big difference. And I know that whichever field of nursing you go into, you're making a huge difference, but everyone has their preferences, and my preference is like an ICU setting for peds as opposed to like a regular med-surg for peds, if that makes sense. Peds it's fun, you know, you get to kind of be a kid from time to time, but it really is draining on the heart, and I am a very emotional person, and it's just hard to disconnect myself from a situation, and that's something that I'm gonna have to learn and develop over time, to be able to separate my own emotions from the care that I'm giving to my patients. And so I think this next semester, where I'm gonna be in med-surg 2, my 4th semester, I'm gonna have to learn to really hone in on that, and consciously say, okay, I can't bring this home with me. I have to leave it here where it belongs. Because I would come home and I would take a shower and go to sleep, because I was just so mentally drained and exhausted. And you know, peds is not for everybody. It's not, but it really is a place where I feel like I could make a big difference. I don't know if I could do it long term. We only had 3 clinicals. I wish we had more to be able to really develop a, is this for me, is this not for me? Because I was kind of like limbo, like in the middle, like yes, one clinical, yeah, I could totally do this. The next clinical is like, I can't do this. So it's just kind of one of those things where if I was given the opportunity, I would not say no to it, because I feel that you are in such a pivotal moment of that patient's life, their childhood, and that parent's life, that it leaves a lasting impression. So with that said, you got to be good at what you do, right? You just got to be good at what you do, and you have to be kind and compassionate. And you know, sometimes a job is a job. Yes, it is, but nursing is more than a job. Nursing is caring. It's about advocating. It's so much more than just a job, and I really figured that out in my peds rotation. As far as what the future holds for me in, you know, the pediatric world, I'm not sure. If an opportunity arose, like I said, I would not hesitate to take on the challenge, because it'll make me a better nurse overall. I'm doing really well in my exams. Go figure. I didn't think peds, I like kids, but I'm one of those strict moms. So, you know, I like my kids a lot. I love my kids a lot, but sometimes it's difficult in the presence of other children that are not mine, that I don't have no control over. But that's just my personal preference. And when you have, you know, parents who are very involved, it can be very taxing, because you're trying to be there for your patient, you're trying to be there for the parents, and you have 4 patients, 5 patients, and it just can be very exhausting and taxing on the mind as well as the body. But I do have 1 more peds exam left, and then I get to take my HESI, which includes my OB and my peds together. So I'm going to be starting to study for that this weekend, and I only have 3 weeks left, like 2 weeks and a couple of days left in the semester, and then I get like a full week off, and then I'm right back into med-surg 2, which is during my summer term. So it's gonna be a ride, that's for sure. Keeping a positive mind, I will get through it. I got this. Self-talk is huge, you know, just being comfortable in your own skin and your own skills and your own knowledge. Sometimes I'm like, how am I gonna remember all this information? Like, it's too much. And yes, it is too much, but you'd be surprised on how much you remember and how much you know. Sometimes you can ask me what Crohn's disease is today, and I'm like, I know it's a GI disorder, but ask me tomorrow and I'll spit out some some facts. It's just one of those things where it's in there, I just gotta look for it. But that is how my peds rotation looked. I will go ahead and do a full semester 3 wrap-up video as soon as I'm done, and I'm done with my HESI, to let you know what I thought of everything as a whole. And so make sure you subscribe so that you can go ahead and get those notifications of when I upload. And I hope that you guys enjoy these nursing videos. Thumbs up if you do, so that I know that you want more. And if you have any questions, leave them down below, as long as my comments are not disabled, because I am also a family vlogger, and as you know, family vloggers have comments disabled. If you haven't visited my IG, go ahead and do that at TheSassyMom82. I'll put it here somewhere. And we can continue the conversation over there. I hope you guys enjoyed, and I'll see you in my next one.